Sam. Thank you. Your heart is beating and your heartbeat is irregular. Is it normal or a sign of something more serious? Here to talk about this is Dr. Edward Carreras, a board-certified cardiologist with the Heart and Vascular Institute at St. Vincent's Medical Center. Doctor, welcome.
Thank you very much for having me.
Thanks for being here. So what is atrial fibrillation and why is it a concern?
Atrial fibrillation is an abnormal heart rhythm in which the heart beats irregularly. And there are two main concerns with atrial fibrillation. The first is that the irregular heartbeat can cause symptoms such as palpitations, a feeling like your heart is beating quickly or strongly, or shortness of breath. The second main concern with atrial fibrillation is that the irregular heart beating can lead to blood clot formation in the heart. And when blood clots form in the heart, they can go to the brain and cause a stroke.
All right, doctor, tell us how this condition is diagnosed.
Atrial fibrillation can be diagnosed on a basic electrocardiogram or EKG that you would have in your doctor's office. This will show the electrical rhythm of the heart, and if the heart is in atrial fibrillation at that time, it will be seen on this test.
All right, talk to us now about what kinds of treatments are available.
And so there are two mainstays of treatment for atrial fibrillation. The first is to manage the symptoms that accompany it, either by preventing the heart from beating too fast or by keeping the heart out of atrial fibrillation, which can be done with medications and sometimes with procedures. The second mainstay of treatment is to prevent stroke. This can be done using blood thinners or with a special device called a Watchman.
All right, tell us more about the Watchman, the procedure, all about it.
Yeah, so most of the blood clots in atrial fibrillation, when they form in a small pouch in the heart called the left atrial appendage. It's this little area in the heart that serves no real purpose, but can be a source of trouble for patients with atrial fibrillation, as that is where most of the blood clots form. The Watchman device works like a plug. It can be placed inside this pouch, preventing blood from entering this area and subsequently forming blood clots. And so by placing this plug and sealing the pouch, we can reduce the risk of stroke with atrial fibrillation without the need for blood thinners. And so patients who are good candidates for this procedure are generally those with atrial fibrillation who are at higher than average risk for stroke, but who are also at high risk for bleeding, who have either had bleeding troubles in the past or for other reasons cannot tolerate being on blood thinners long term.
Who is most at risk for AFib? Certain age, certain sex?
Yeah, the risk for AFib definitely increases with age. So we see over the age of 65, the risk goes up significantly. And then patients with other known heart conditions, patients with heart failure, patients with coronary artery disease find themselves at higher risks.
And a quick last question, when should you go to the hospital or call 911?
So you should always have a low threshold to reach out to your doctor if you're having any symptoms. Typically, patients with atrial fibrillation who are experiencing symptoms such as palpitations, shortness of breath, pain in the chest, should at the very least have a conversation with his or her doctor, and if unable to, in quick form, should go to the hospital.
All right, Dr. Edward Carreras, thank you very much.
Thank you so much for having me.